It's the new 96 one now. Russell and Raven here. Dr. Fred Campbell from UT Health is joining us right now on the phone here to help shed some light on really what's going on with coronavirus, because there's so many questions.
There are.
Dr. Campbell, I'm just going to roll through some of these, and you can kind of do lightning round here and just kind of give us your thoughts.
Sounds great.
Okay. Question number one. Is it still safe for me to go out and walk my dog?
Yes. And animals are not going to be at risk or likely to transmit.
Good deal.
Yeah.
Okay. This is from Allison. She says, if I get coronavirus and recover, can I get it a second time?
Unclear at this point.
Elizabeth wants to know, she says, I'm pregnant. Are there any specific risks to women and babies?
Well, yes. Pregnant women, even though they usually get through infections like influenza quite well, are recommended to be immunized. And unfortunately, we don't have an immunization yet for that. And so the sooner the better.
This question comes from a girl, her name's Raven. I don't know if you know her, but she says, if I'm already on antibiotics for something like strep, am I in the clear?
No, unfortunately, there is, as far as we know, no effective way of treating COVID-19.
Darn it.
Yeah. Well, if you're getting a question, then I am. Is there any risk to people receiving radiation or chemotherapy?
Yes, there's certainly some very strong chemotherapy agents that could cause someone to be immunosuppressed. Yeah, that would be the highest risk population that I can think of. And so that would be a situation where you have to be very careful about self-isolation.
Yeah, that's a good point. What if we come into contact with somebody who eventually contracts coronavirus? What should we do in that situation?
Depends on when you actually come into contact with them and when they develop the virus. Within 48 hours would be a higher risk situation in terms of getting your own case. I'd certainly be concerned if it was true that someone had a definite case that was proven by testing.
Okay, last question here. Kind of in jest a little bit. The San Antonio summer nearly kills me every year. Will it kill this virus?
No, actually, I don't think warm weather has anything to do with the virus itself.
Wow. Well, this has been great. Listen, I know people are going to have more questions as time goes on, so maybe in a couple of days, if you're not busy, we can check in again and kind of see what's going on, and you'll let us know if something breaks.
Be delighted to help out.
Perfect.
Thank
and
you.
if you need any TP, I know a guy who's selling some. So,
Excellent.
Dr. Fred Campbell with UT Health, thanks so much for coming on, man.
Okay, my pleasure.